Good day, I am Lasutaz, and today we will tackle about infection control in oral surgery. The unique nature of dental procedures, instrumentation, and patient care settings require specific strategies directed to the prevention of transmission of diseases among dental healthcare workers and their patients. Disease transmission. Disease transmission. Infections are spread if the following criteria are satisfied. First, the presence of a susceptible host. Second, the presence of a pathogenic microorganism. And third, if there is a portal of entry via which the organism invade and colonize to the susceptible host. Absence of any of these requisites will prevent the transmission of an infectious disease. Therefore, the goal of infection control is to eliminate one, two, or all of the criteria. It should be understood that the exposure to microorganisms and infection are not synonymous. It is impossible to avoid being exposed to microorganisms. However, exposure will not cause disease unless three previously mentioned criteria are present. The medical history. A thorough medical history should be taken and updated. It is essential in alerting the clinician to the medical problems that could, in conjunction with the dental treatment, adversely affect the patient. Protective measures includes immunization, protective coverings, knowledgeable about the sharp instruments and needles, first aid and inoculation injuries. Immunization. All dental healthcare workers are advised to be immunized against Hep B virus unless immunity from natural infection or previous immunization had been documented. Protective coverings includes uniforms, hand protections, protective glasses, mask, or face shields. Uniforms. Uniforms should be changed regularly whenever soiled. Gowns or aprons should be worn during procedures that are likely to cause splattering or splashing of blood. For example, the oral surgeries that we are about to perform. Hand protection. Gloves must be worn for procedures involving contact with blood, saliva, or mucous membrane. A new pair of gloves should be used for each patient. If a glove is damaged, it must be replaced immediately. Hands should be washed thoroughly with a proprietary disinfectant liquid soap prior to and immediately after the use of gloves. Disposable paper towels are recommended for drying hands. Any cuts or abrasion on the hands or wrist should be covered with adhesive waterproof dressing at all times. Protective glasses, mask, or face shield should be worn by operators and close support dental surgery assistants to protect the eyes against spatter and aerosols, which may occur during cavity preparation, scaling, and the cleaning of instruments, or in our oral surgeries. Sharp instruments and needle should be handled with great care to prevent unintentional injury. Needles should never be recapped by using both hands in direct contact, or by any other technique that involves moving the point of the used needle towards any part of the body. The needle can be recapped by laying the cap on the tray, placing the cap in the resheathing device, or holding the cap with the forceps before guiding the needle into the cap. First aid and inoculation injuries. In the event of a skin puncture by a contaminated instrument, the wound should be encouraged to bleed and washed thoroughly with running water. All incidents should be reported to the officer in charge of the clinic. Where there is a reason to be concerned about the possible transmission of infection, advice on appropriate serological testing, medical evaluation, and follow-up could be sought from the Accident and Emergency Department, or AIDS units, and the address and contact telephone of the patient concerned should be recorded. Instrument sterilization. All instruments should be cleaned thoroughly before sterilization by rinsing and scrubbing with detergent and water. Splashing of water should be avoided. Heavy-duty gloves and, where appropriate, face protection shield should be worn. Items which will penetrate tissues must be sterilized in an autoclave or hot air sterilizer. Items which will touch the mucous membranes but not penetrate the tissues should similarly be sterilized by heat, or if not possible, be disinfected. It can be disinfected by immersion in 2% glutaraldehyde solution in a closed container according to manufacturer's instruction. All chemical residues must then be removed by thorough rinsing before use or storage. Handpieces, ultrasonic scaler inserts or tips, and air syringe tips, where detachable, should be flushed for 30 seconds, dismantled, cleaned, oiled where required, and autoclaved between patients. Handpieces left overnight should be allowed to discharge water for 2 minutes at the end and beginning of the day. Following sterilization, all instruments should be stored in clean containers to prevent recontamination. Surgical and endodontic instruments should be kept in closed containers. It may be necessary to re-sterilize them and immediately before they are used, and care should be taken to ensure the instruments are cool prior to use. Surface disinfection. Surfaces that are likely to become contaminated may be decontaminated after treatment or protected with disposable coverings before they become contaminated. So, example here are cling wrap. Effective cross-infection control is aided by strict system of zoning and the use of sterilizable trays. Procedures should be adopted which limit the areas touched and contaminated each time a patient is treated. Between clinical sessions, work surfaces should be thoroughly cleaned and decontaminated with ethyl alcohol 70%. If there is visible blood or pus, the surface should be cleaned and disinfected with sodium hypochlorite 0.5%, followed by water rinse. Protective gloves should be worn and care taken to minimize direct skin, mucosal, or eye contact with disinfectants. Aspiration and ventilation. The use of high-volume aspirations will reduce the risk of cross-infection from aerosols. The risk is further reduced by good ventilation. The tubings of high-volume aspirators and saliva ejectors should be flushed with water between patients and with disinfectant, regularly or according to manufacturer's instruction. Disposal of waste. Sharp items include needles and scalpels, and local anesthetic cartridges should be placed into puncture-proof containers which should be securely sealed. These, together with all medical waste, must be disposed in red bags, securely fastened. Red plastic bags are to be picked up by a special collection of service for hospital and clinics. Non-infective waste should be disposed of in thick black plastic bags securely fastened. Liquid waste should be carefully poured into a drain and then flushed in with water. Spatter and splash should be avoided.